keep your mic muted. Unless there's an opportunity for engagement for questions, so if Kristen asks for those, please feel free to unmute yourself. Also, you can always feel free to pop any questions in the chat as we go along, and we'll make sure to address them either as it's appropriate or at the end. So we'll make sure that we kind of keep track of that. I do want to remind everybody to please remember that we do have closed captioning enabled for everybody. So if you would like to use that, you can find that at the bottom of your screen. If you're on a different device, sometimes it might be on the side or the top, but you can go ahead and enable that. It'll have like a little CC icon on it, and sometimes, depending on your device, it might have a world or a little box with a CC in it. It depends on your device what it'll look like. Our session today is going to be recorded. You had to click yes for that, and that will be sent out as soon as it's captioned. So then that will be sent out via email. We will also post at the end of the class a link in the chat for the evaluation for today's session. We ask that you please take a moment to fill that out. We really do appreciate your feedback, and that information really helps us with our programming and to help us meet the needs of our clients so that we can always make this better. Again, thank you so much for joining us today. Today's session is Male Milk and Medications, Navigating Care Roles. We're excited to welcome Crystal Litzman, and I'm going to turn it over to her to formally introduce herself.
Hi, folks. I am so pleased that we are all here today. I really appreciate having you on the call. I'm really excited to talk about a few things that we relate to family caregiving and kind of the way that families interact as people get older, as people develop health conditions, and as we start doing more and more help for our loved ones, which is really, really common and almost universal. So to Alicia's point, or to, I'm sorry, Amanda's point about participation, I do have a few opportunities for participation. And before we jump in, I just want to make sure that you all know that this is an invitation, not a requirement. So if you're driving, if you're on the phone, if you're chopping vegetables for breakfast, whatever you're doing, if you just don't want to, that's okay. Don't worry about it. But if you're on the call and you do want to participate and share either with your voice or with typing or with the other opportunities that I offer, I love that. That's a part of what we're going to do here. And I'm excited to have this be a conversation. Okay, so as we get into this here, I'll introduce myself first. I'm Kristen Litzelman. I am an associate professor at UW-Madison, and I'm also a state specialist for extension. So I build a bridge between what we do in the research world and the information that we're able to give to families and communities in order to help people have the information to live full and healthy and happy lives. So today, I'm wanting to delve into a topic that gets more and more important over the past few years here in Wisconsin and also nationally. It's been important for a really long time, but it's getting more and more attention these days. And that topic is family caregiving. So before we get into the topic more deeply, I want to start with a little poll. And we had a little technical snafu. So Alicia is putting the poll together for me as we speak, I hope. Oh, she launched it. Perfect. Okay, so go ahead and fill out this poll. And there's two questions. The first one is, do you provide regular help to a loved one who has a health problem or a disability? You can say yes, you can say no, you can say maybe or I'm not sure. The second question is, do you expect to start providing this kind of help in the near future? So near future, you can define. Maybe it's the next year, maybe it's the next 2 years, maybe it's the next couple of months. That's up to you, how you think about it. But you can also answer that with yes, no, or maybe. So I will give you a few moments to answer that poll. And Alicia, when I do this, I often do it popcorn style. So it's the idea of like when there's a lot of popping that happens right away. And then when the popping slows down, that's when it's done. So you can kind of be my judge of how that's going. Okay, so it looks like we have some results here. So what we're seeing is that about half the people on the call feel like they are already providing care to someone who has a health problem or a disability, one of their loved ones. And almost 2/3 feel like they're going to start providing care in the near future. So that's a lot of people. And I only had a few people who answered maybe, which is not very surprising. Usually people have a good sense of whether they're doing this or not. Um, but we've got a lot of people who are doing this important work already. So when we ask people across the state, across Wisconsin, about their responses to this, here's what we see. Around 19% of adults in Wisconsin say that they are currently caregivers, say that in the last month, they've been providing some kind of help or support to a loved one with some kind of health condition or disability or frailty. And another 13% say that they expect to become caregivers in the next 1 to 2 years. So that's a lot of people in our state. This is what it looks like when we map it out. It's a lot of people in our state who are providing care. And that also tracks with what we see nationally. There's a whole chunk of people, when you look around a room, about 1 out of 5 people are already providing care, and a bunch more think that they're going to be providing more soon. The thing is, we often don't see it in ourselves. These care roles tend to sneak up on us. Sometimes they just feel like a normal part of a relationship. So it's a normal part of being a caring partner. It's a normal part of being a caring child to your parents. It's a normal part of the love and care that we give to our neighbors and our friends. And so it can really sneak up on us because it just feels like part of the relationship. It just feels like what we do to love and care for the people in our lives, until all of a sudden it's a lot and it doesn't feel normal anymore and we're not sure why. Sometimes it just comes up really suddenly and surprises us. Sometimes it sneaks up and out of the blue, all of a sudden we're taking on a really big care role that we didn't necessarily expect, or even if we kind of expected it, it still takes us by surprise, and it can really throw us off kilter and make it hard to do the things that we want to do in the world and to live our fullest lives. So one of the things that we want to address today is that understanding care roles now can help us navigate them later. And this applies to people who are already in care roles, and also people who think they might be in care roles, and even people who have no idea what a care role is. Because thinking about these things now, whether we're already doing this important work or whether we are planning to in the future, thinking about it now can help us thrive and have an easier time adapting and adjusting and living our best lives. So here's our objectives for today. If you only leave here with one thing today, I want you to be able to look around and identify what care roles or tasks look like or feel like. Some of you may already be there, and so you are already on board, you know these things, but for some people it can be sneaky. And so being able to look around and say, ooh, that's a care task, I do that. Or, ooh, that's a care task, I know someone who does that. That's the first goal for today. The second thing I want you to leave with, if you only pick up 2 things, is an ability to sort of look at what that experience is. And I'll give you the spoiler here. The thing that I'm gonna try to really leave you with is that the way people are impacted by a care role varies dramatically from person to person and situation to situation. And so I want to talk a little bit about that. I want to talk a little bit about the good, the bad, and the ugly of caregiving, and sort of what it is that sets us up for those reactions. And for some stuff, we can do things about it. So how can we lean towards having more positive impacts from caregiving and minimizing some of the stress that we sometimes feel in that role? And then the last thing is that I want you to be able to leave here kind of thinking a little bit about, what is this like for me? What are the impacts for me if I'm already in a care role? What do I think maybe the impacts would be if I'm going to be in a care role? And what are the things that I can change in my own life in order to set me up for success, and minimize the negative impacts and maximize those positive impacts? So those are the goals for today. So the first piece that I want to touch on here is something that may seem obvious or may seem completely not obvious. And it's the idea that when someone has a health challenge, that causes ripple effects towards other people. So when one person in the family is facing some sort of health crisis, if it's a sudden thing, or some sort of health challenge, if it's not a sudden thing, that doesn't just impact that person, that ripples out to their family and loved ones. And it impacts a spouse or partner who cares about that person and is worried about them, who helps out with making sure that they're getting to their appointments on time, maybe making sure that they're doing the things that they need to do to take care of their health, whether it's taking medications or moving their body the way that they need to, or eating the food that they need to. It also impacts the roles of those other people. And so that means that when we have a relationship with someone who has a health crisis or a health problem, we kind of shift around in the things that we do. Maybe all of a sudden we're taking on more housework than we had done before. Maybe we have a job that we work for pay, and so we're also an employee, but now we've got a lot of stuff on our mind. And so we are doing this paid work and our brain is there, but we're also thinking about our loved one and we're making appointments. So there's a ripple effect, and it ripples out into emotional well-being. It ripples out into the roles that we play. It ripples out into the way we live in our relationships. It ripples out into just the way our life is structured in general. So again, this may seem really obvious. In fact, I hope it does, because for me, this should be intuitive that, of course, when one person is having a health challenge, it impacts everyone else around them. But sometimes it's not. And so sometimes I feel like I need to come forward with this right away and just point out that health problems don't happen in isolation. They happen in community and in context with everyone around. And so it's very normal when someone we love is facing a health challenge for us to feel like we're impacted that as well. So what do care tasks look like? And again, I'm hoping that this is obvious, but sometimes it's not. And so I want to come right out and say it. So sometimes care tasks look like sitting in on health appointments. So going along and just being an extra set of ears or an extra set of eyes and being part of that communication with the healthcare provider to be able to talk to them about what symptoms someone's having, what their experience has been, ask questions, gather information. That's a really important care task, and one that I think we don't always think of. It looks like helping with housework or chores. I mentioned earlier that sometimes when someone is having a health challenge, we have to shift things around. Responsibilities get shifted around. So maybe all of a sudden we're doing a bigger volume of housework than we had been before. We're splitting tasks differently. Or maybe we're doing housework or chores that we had never done before, or that really were not part of our wheelhouse and the things that we're most comfortable doing. And those shifts have a big impact, even though they might seem kind of small. Picking up groceries or bringing a meal, that's a care task. Driving a loved one for their errands, or even just going along, that's a care task. Helping people with personal care tasks. I think this is the one that when people think of caregiving, if they do it all, this is one of the things that they think of. It's helping someone with the things that they need to do to stay healthy in their lives, including things like showering or eating. But that's just one of many care tasks that come up for people. Sometimes we're managing finances, whether that is helping someone think about it, taking them to the bank, or if there comes a time when they aren't comfortable or aren't able to manage their finances anymore, sometimes a loved one has to take that on. So that's a care task too. Encouraging a loved one to take care of themselves. I think this is a really sticky one, because when we have someone in our lives that's facing a health problem and they have a certain set of things that they need to do in order to stay as healthy as they possibly can, I've been in the situation where I know that I'm supposed to do something and I don't want to do it. So I don't do it. And I think that's true when we see other people too. It's really hard to see someone struggling to do the things that they need to do to stay healthy, whether that's taking their medications on time or moving their bodies. And so part of a care task is helping people to do that own self-management, to do that own health, their own health care. And that can be a really tricky one because there's relationship pieces in that and there's communication pieces in that that can be really hard to balance. And lastly, providing emotional support. Sometimes care tasks just look like being there for someone to vent if they had a challenging meeting with their healthcare provider, or if they're feeling really upset about not being able to do things that they want to be able to do, or if they're feeling worried about their own health. These are all care tasks. And they're all really important, but they may not always be things that we think about. So that's why the title of this is Mail, Milk, and Medications, because those are things that are care tasks, even if we don't always think about them that way. So I'm going to call this caregiving. There's lots of different words we can use for it. I've learned that thinking of ourselves as a caregiver, bringing that as like part of who we are, can be really challenging, but realizing that we do care tasks is often a lot easier. So I talk about it as caregiving, but we can also think about it just as what we're doing, as doing these care tasks. And I think some of the time when I say the word caregiving, people who've thought about caregiving at all, which certainly isn't everyone, have a little bit of an idea in their head about what caregiving looks like, who are caregivers. And it differs from person to person. But I'm going to tell you, no matter what that sort of like quintessential caregiver is that you might have in your head, it goes much broader than that because caregiving crosses all ages. There's people who are young adults who are in caregiving roles. There's people who are 95 years old who are in caregiving roles. It crosses relationships. A caregiving role can be caring for a spouse or a partner. It can be caring for a parent. It can be caring for a child if they are an adult child or if they're a young child who has some kind of extra healthcare challenges. And so the care that they need goes above and beyond what you might see on average. It can be caring for a friend or a neighbor, helping mowing the lawn, helping bring food. And I want to capture all of that as caregiving, even the simple stuff like bringing in mail, because those are such important roles and we should honor those, and we should embrace the privilege of being able to help people and how good it feels to help people. And also because sometimes those roles start small and then they kind of sneakily turn into bigger and bigger roles where we as individuals might need more help and support. And so we want to be able to capture all of that. So here are just a few images to sort of capture that idea that caregiving crosses all kinds of boundaries. The age of the person who needs the care, the age of the person who's giving the care, men and women, different groups across our state. There's lots of different places where people are caregiving. And I want to make it so that everyone feels like they can be part of that group because we all are in care roles at least some of the time. So here's a quote that I think if you are involved in any caregiving conversations, this is going to come up in almost every one of them. This is from Rosalind Carter, our former First Lady. And she has been a real advocate for family caregivers in helping get them support, in helping make sure there's awareness raised about them. So here's what she said about family caregiving. There are only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers. And if we're not already in one of these categories, we will be in the future. And many of us will be in multiple of these categories at some point in our lives. It is so common that we expect everyone to be impacted by caregiving at some point. Back in 2018, there was a group in Wisconsin, several different community organizations in Wisconsin were part of this, that did an awareness campaign. And the idea was to sort of raise awareness about what caregiving really is, because we have that idea of what it is, and it looks like a lot of other things besides that. So these are a few of the submissions and the products that came from that campaign, and I'm just going to show you a few of them here. So it was called You Might Be a Caregiver If. Here's the first one. You might be a caregiver if your date night is at the doctor's office. So what we have here is a picture of 2 people holding hands, and black and white. And you might be a caregiver if your date night is at the doctor's office. The next one is an image that we sometimes see in sort of online memes of a woman, an older woman who's holding her glasses and she's looking at a computer screen, kind of leaning forward. And it says, you might be a caregiver if you spend hours online learning about health issues. This next one is a picture of a bird feeder. You might be a caregiver if the first thing you do in the morning is fill your neighbor's bird feeder. Here's a picture with some pill bottles. You might be a caregiver if you know more about current medications than current movies. This is a picture of a kitchen, and there's a woman who is in the kitchen. She's standing upside down on the ceiling. So her feet are on the ceiling and her hair is hanging down. And it says, you might be a caregiver if you become a waitress, nurse, chauffeur, and entertainer. This last one is a picture from a movie called Office Space. It's a man who's sitting at his desk. He's wearing a tie and he's got a red stapler on his desk. And it says, you might be a caregiver if you do more paperwork than you ever did at a paid job. So these are just some examples of what caregivers experience and the way that they realized that they had become a caregiver. Lots of different experiences here. Some of it is about specifically health issues. Some of it is about paperwork. Some of it is about medication. Some of it is about all of those tasks that people do and trying to balance all of them. Waitress, nurse, chauffeur, entertainer, trying to do all of those things. Some are small, some are big. It's all care tasks, and it's all part of being a caregiver. So there's all different types of care tasks. And I want to make sure that we sort of know what these are. We can put these into categories. I don't know that categories are helpful. I think if you look at it and you say, hey, this is a care task, then it's a care task, and that's okay. But there's been some research trying to categorize how we can think about care tasks to help us be able to sort of organize them. I think of it as like a garage organizer where you can hang your ideas. So these are just some of the care tasks that we can talk about here. So some of them are those household tasks, personal care, emotional and social support, medical tasks. So this is something that as caregiving gets more intense or is sudden, sometimes people take on a lot of, is doing medical tasks at home. It can be everything from taking someone's blood pressure all the way through to giving them injections or making sure that they're taking their medication the way that they need to. Care coordination is where we're making sure that one doctor knows what the other doctor said and that the appointments are scheduled on time and that they're in the order that they need to be in, and that health insurance has been approved for that we get pre-approvals from health insurance, or if there's something health insurance won't cover, we're calling and making sure that we can get it covered. It's a big job and ends up being a lot for some people, but is really, really important and a big role that people in care tasks play. Sometimes it's planning and finances. This isn't just like managing someone's finances or making sure they have enough money to meet their needs. Sometimes it is just planning out, okay, who is your power of attorney going to be? Have you made the plans for who's going to help you after a healthcare procedure? So it's thinking about all of those things. And then the last one is that self-management support. So I talked about this a fair amount earlier, but it's this idea that people help their loved ones take care of themselves. And it doesn't always feel like caregiving, but it can be stressful and it can be challenging. And it can also be really, really give a lot of purpose and meaning in someone's life. So that's a really big role that caregivers have. So when we look at people across the country, we see that around 40% of people who are in care roles or who self-identify as caregivers are helping with personal tasks. So that's the things like showering and eating and helping people in that really intensive way. 76% are helping with household tasks. So they're doing one or more things around the house. They're helping clean the house. They're helping with yard work outside. It's that milk and mail piece. And on average in Wisconsin, caregivers spend about 20 hours a week in their care roles. So again, these are people who are self-identifying, which means that people who are just bringing in mail probably aren't included in this number. But when someone gets to the point where they say, yes, I am providing help and care to someone with some sort of health condition or disability, they're spending an average of 20 hours a week. So some of these people are spending 10 minutes. Some of these people are spending almost every waking hour of their day providing care. And there's a really big range. And all of that is care tasks. All of that we can think about under the umbrella of caregiving. This is another slide that is showing you the exact same information. I included this not so that you could be overwhelmed by how it looks, but so that you can have some examples of what care tasks are in these different categories, so that you can come back to them later if that's helpful for you. So this is in the slides that you would have gotten over email. You are free to look through this at your leisure. I'm not going to talk through it now because, again, it's an overwhelming slide, but I wanted to make sure that you have this information if you want to look back at it later. Okay, so I have been talking and talking and talking. So I want to have you share out. And again, some of you already have told me that you are caregivers, so you know that you do care tasks. But I want to invite you to join us in this and just make an annotation on which care tasks you feel like you do, or which ones are top of mind for you. Which are the ones that you're like, yes, that's my biggest care task, or ooh, that's my hardest care task. So to do annotations, you're going to go to the top of your screen and hover over, I think how you hover over your name, and then sort of to the right-hand side, right of middle a little bit, there's a button that says annotate. You click that button, and then you can get a little tool where you can write. So I'm going to write on here. I see someone's already annotating. You've got a tool where you can type if you want to type something. And I'm doing that too so that you can see. And I think you can even get stickers or dots, or I see someone put a star on here. So go ahead, let's take a moment and just annotate if you feel so inclined, and sort of show me which tasks are you doing? Which ones are most salient for you right now? I'm seeing household tasks. I'm seeing a lot of emotional support.
You can feel free to put those in the chat and I will annotate for you also.
Yeah, thank you. So I will say in my care role, man, I do all of these things. And so what would I say is the most salient for me? That's a really hard question. So if you're sitting here and need to just think about it a little bit, you're welcome to do that. I think one of the reasons that I talk a lot about self-management is because that's so hard for me. I know it's not hard for everyone, but for me, it's so frustrating to see what someone needs to do and to say, I can help you, let me help you. And the answer is no, I'm not doing it. I don't want to do it. And that, I mean, we as individuals have agency in that. And that is something that I am willing to respect, but it's really hard to feel like I have a solution and you won't take my solution. And that's me. That's something that I need to process and that I need to sort of give myself grace for so that I can have that flexibility. And as we're doing this, I'm going to open up, just because I think we are good on time so far. I'm going to open up if anyone has anything that they want to share by unmuting, or if they have anything that they want to put into the chat, just reflecting on the care tasks that they do and how it's meaningful for them, or how it feels really, what feels most important for them. I would love to hear that.
Kristen, in the chat, some people have shared that they do pet care and household tasks, also emotional support, care coordination, and the power of attorney.
Yes, yes. And that has me thinking a little bit about the way that these roles can sometimes be complex, because we can be caring for someone and also have people caring for us. And so I know in my personal experience, I have been a caregiver, and in that role have had people bring me meals. And so the people who are bringing me meals, they're doing care tasks and I'm doing care tasks. And so there can be a big circle of care that's happening. I know that in other circumstances, I've been doing care tasks for other people, and those people, those same people, have been doing care tasks for me. And we're just doing different care tasks because we have different strengths and because we have different needs and because we're supporting each other in different ways. So it can be, it's not black or white, it's not one or the other. It can actually be very kind of beautifully complex.
Kristen Roy says it took him a while to realize that he was a caretaker.
Yeah. Yep. Yep. That's very common. That's very common. And I think one of the reasons that I wanted to have this conversation is because what I often see happening is that people don't think of themselves as caregivers or caretakers until they're feeling stressed or burnt out. And there's so much that we can do. There's so many services and supports available in the community that can help people before they get to that point, but they don't even think about it because they don't think of themselves as a caregiver. They think of themselves as just, this is just what a loving spouse does. This is just what a loving child does. This is just what a loving sibling does. So that's very, very common. And that's why we're having this conversation. Okay, so one more piece of annotation. So I'm going to clear this. Yeah, thank you. I love that I have this tech support here. Okay, so we've cleared that. So the next one that I want you to just think about a little bit, in case that didn't resonate, is, ooh, I know someone else who does care tasks. And maybe I haven't thought of it that way before. Or maybe they don't know that they're doing care tasks. So go ahead and just take a moment to annotate this piece too, and just think a little bit about, is there someone else in your life, a colleague, a friend, a neighbor, a family member, who is doing care tasks for a loved one and maybe just doesn't realize it?
While you're starting that annotation, I'll share with you some of the things that are in the chat. So one participant shared how they provided care for parents, 6 a.m. until 1 p.m. and then eventually 24-hour care. And siblings helped, it says. And it says that it was grueling, but I would do it again.
Yeah. Yep.
And then someone else shared that they do all of those tasks. Their husband has lung cancer, and also an ill sister-in-law has now passed away. They deal with lawyer stuff, it looks like, keeping up the household.
Yeah.
Lots of care task work.
Yeah. Yeah. It can be a lot. It can be a lot of work, and it can be very gratifying. And so that actually moves us directly into the next section. So I'll just comment on this slide a little bit, and then we'll go exactly into that. So I'm seeing there's a lot of advocacy and planning pieces that are popping up on here, that someone else is doing a lot of those. There's care coordination pieces that are popping up on here. So we can see this not only in our own lives, but also in those people around us. And as I said, it can be very interconnected, where people can be caring for each other at the same time in different ways and with different needs. Okay, so we'll clear that out again, and we will move on to the next slide here. I'm just going to close my annotation tool. Okay, so everyone experiences caregiving differently. People need different things work for them. And so this is one of those key points that I want you to come away with. So the slide here says, all people are different people. This is a quote from a TV show called Ted Lasso. And this is one of the things that came up in that show that has stuck with me. This idea comes up for me all the time. All people are different people. And so in the context of care tasks or care roles, what I mean by that is everyone experiences these things differently. There's a huge range, there's a huge world of experiences that people have. And so no matter what experience you have or will have or find yourself having, you are in good company. There are benefits and challenges, and these things can be experienced at the same time, even if they both feel really strong. So most caregivers, and when most I say like, oh, it's like 9 out of 10, or maybe even more than that, see positive aspects of caregiving. They can identify at least one thing that is a benefit from caregiving, whether that is feeling like they have purpose in life, whether that is feeling like they have a sort of a strong relationship that they're building or rebuilding or experiencing with the person. It can feel like an honor. It can feel like something that is building skills. It can feel very, very good. And simultaneously, caregivers also see difficulties and challenges. And so this is what I'll talk about in a little bit. Sometimes those difficulties and challenges are big things like, oh my gosh, I'm so stressed and anxious. Sometimes they're little things like, I can't concentrate because I have so many things on my mind. And we don't really understand why we're experiencing that, but it's because the mental load is there. Because there's so much in our brains, it can make it hard to focus and make it hard to do the other things in our lives, or hard to remember things. I will say that not so long ago, I put the salt in the fridge and I couldn't find it for days. And it was because I just had so much on my mind that I couldn't think straight. I was just doing things without really recording in my brain what I had done. These also change and evolve over time. So someone may experience one thing in one moment and the next thing the next moment, or especially as these care roles evolve and change over time, we can see those reactions change over time. So it can be that caregiving gets more stressful over time. It can be that it starts out really stressful and then we learn and we get used to it and it actually gets less stressful. All of those things are normal and all of those things are common. And as I want to make sure we are really clear on, these things coexist. So it's not, ooh, I have challenges, so I can't have benefits, or ooh, I have benefits, so I'm protected from challenges. These can both exist at the same time. We can feel like there are a lot of difficulties and challenges with caregiving, and like it's one of the most beautiful things that we've ever done, all at the same time. So let's start with that benefit side. When we talk to caregivers, so this is caregivers across the United States, they tell us that they experience purpose and quality of life. So 96% of caregivers agreed with the statement that their life has meaning and purpose. 94% feel like they are confident and they feel good about themselves. 86% like their living situation. So when people, again, this is people who are self-identifying as caregivers, so it's probably not the people who are saying, oh, I bring in the mail, but that's about it. They feel like their life has meaning and purpose. They're feeling good about their lived experience. And this is also true when we look across people more broadly and ask them about whether caregiving gave them a sense of purpose. So nationally, more than half of caregivers say, yes, they agree that caregiving gave them a sense of purpose. It's not just they have a sense of purpose in general, it's that caregiving contributed to that. It gave them that sense of purpose. Other examples of positive things that people take out of caregiving, they get health and well-being benefits. So one of the things that we see is that when caregivers aren't experiencing a lot of stress and strain, when they're like pretty calm and feel pretty resilient, they actually have better health. They have better quality of life. They have better emotional well-being than people who aren't caregivers because we get something from that. We gain some beautiful things from being caregivers. When stress and strain is high, things get harder in that domain. But when people are balanced, when they feel like they have everything under control, there's real benefits from being a caregiver. We've got those relationship and connection pieces where we feel like we're building that relationship. We feel connected with someone. We make meaning of our lives and our experience through this role. There's a lot of gratitude that comes up for caregivers. They feel grateful for the privilege of being able to be in this care role. They feel grateful for the family and friends who come around them and help them. And there's even transferable skills. We learn things from being a caregiver about relationships and communicating, about management, time management, stuff management, communicating with those care coordination roles. We learn all kinds of transferable skills, sometimes even actual nursing skills that we need to have at home. And those we can use in other settings as well. And so there's all of this problem solving. There's all of this capacity that gets built through these roles that we can then take forward with us. And at the same time, sometimes care tasks are difficult. So again, this is that same survey of caregivers across the United States. And among people who did each of these care tasks, there is a chunk of people who found them difficult. So I don't think it's surprising to know that around 1 in 4 people who did personal care tasks felt like personal care was difficult. So that's, again, things like helping someone bathe or shower, helping someone eat. Those can feel really difficult. And so it's not surprising that a large chunk of people felt like those were difficult and said that those were difficult. But even things like helping with shopping or helping drive someone places or helping with chores, even those things can feel difficult. And again, it's not separate from the idea of feeling that there are benefits or noticing the positive aspects of caregiving. These things can feel difficult at the same time. And so one of the core reasons that I want this to be something that you see today is so that if you're in these care tasks right now, or if you find yourself doing these care tasks in the future and it feels hard, I want you to know that that's okay and that's normal, because sometimes things feel hard and different things are going to feel hard for different people. So altogether, around 1 in 3 people said that there was at least one care task that they had difficulty with. So a lot of people don't have any difficulties at all, but for some people, there are difficulties, and that's normal and that's okay. And even if it's something that feels like maybe it should be easy, like shopping, it's not necessarily, because there's a lot of mental work that goes into that and physical work, and we have to fit it into our whole lives. Overall, we see a huge range of experiences for family caregivers. So this is, again, national data from a different data set. But when we ask people about their care roles, caregivers say, around 36% of caregivers say that they had high emotional stress because of their role. And 36% of people are also saying that they had low emotional stress because of their care role. So it goes both ways. There's some people who have high stress from it. There's some people who don't. And we fall across that whole range. A small group of caregivers said that they had physical strain from the role. So I can imagine that this is like someone who needs help getting out of bed or someone who needs help getting up from a chair. That can be a physical strain for sure. So there's a chunk of people who say, yep, I am in a care role and it's causing me physical strain. But there's a whole big group of people, more than half of the respondents, who didn't say there was physical strain from their care role. So again, there's a wide range. Loneliness has been a concern, especially following the COVID-19 pandemic, where we saw an uptick in loneliness because we separated everyone. And then, of course, that's the unintended consequence, right? People feel lonely, people feel isolated. So that can be true for caregivers as well, especially in the context where they feel like they can't get out of the house, or they feel like there's so much unpredictability that they can't plan things. Those are common feelings. So around 21%, that's about 1 in 5, said that they felt alone because of their care role. And the majority of caregivers didn't say that they felt alone, felt like they weren't alone because of their care role. And in fact, we can feel more connected sometimes from our care role because we're connecting with our support system, because we're connecting with other people who are in similar roles. And that can feel really comforting and really connecting. Financial challenges are also really common for families when they're facing a health crisis. So around 18%, again, that's around 1 in 5, said that they had financial strain from their care role. But again, over half of people said that they didn't have financial strain from their care role. So my point here is that all of these are normal. All of these are common. There's a huge range of experiences. So I'm going to pause here. So I'll just preview for you where we're going next. The next thing that we're going to talk about here is just a little bit of time talking about why we see this range. But before we get into this, I'm going to keep this a little bit short. But before we get into this, I want to know what's coming to mind for you. What are you thinking about in terms of the way that you've been impacted by your care role, the way that you think you might, and kind of what that meaning is for you? And again, this is an invitation. You certainly don't have to share, but if anyone would feel good about that, I would welcome that reflection.
Kristen, I was thinking about how even the task of shopping, how it's such a wide range of how it impacts the caregiver. So you have where you can like go online and make a Walmart order and it can be delivered right to your care recipient's door. And so maybe it takes you about 10 minutes to do in the morning and it's all set up. Or I remember going with my mom, was caretaking for my grandparents, and she would have to go collect them. She would go and pick them up, get them in the car, take them shopping. My grandpa would like go off in one direction and we wouldn't be able to find him. My grandma was wanting things from the high shelf, but she was in a wheelchair. And it was just like, it was kind of like a circus act when we would go into the Walmart. And it would take a couple of hours to do it. And my mom would come home and need a nap when she was done. And so like just the difference of simply grocery shopping, how it can either be a really taxing but valuable event. It also was my grandpa's favorite day of the week. Is when he got to connect and to be out and about because they were not driving. And so so valuable, but so taxing, or just really, really kind of like one of those low hanging fruits, easy to caregive tasks.
Yeah. That's a really fabulous point. Yes, there's a huge range of the experience. And it can be difficult no matter what, and that's okay.
Mary Lou put in the chat that caregiving is a rather natural human experience that compassionate people do. And then I had a private message that said, giving support to others who are direct caregivers. This information helps confirm feelings that they share. It's not just them. helping them feel the importance of staying connected.
Yep. Yeah. And that's exactly why I want to share this out, because no matter what the experience, it's normal and other people have that shared experience. And sometimes I think that's hard to see, but it's so important to know. Okay, so why are experiences so different? So we can have two people who are in the exact same care role and they have completely different lived experiences of it. The way it impacts them is completely different. And that's because caregiving happens in context. It's not just in its own little vacuum sealed bubble. It happens in the context of other roles that we have in our lives. Maybe we are also an employee. Maybe we are doing multiple care roles. Maybe we're trying to parent young kids and provide care for someone at the same time. It depends on life stage, whether there's other people we see around us who are in care roles. It depends on the relationships, the environment, the finances that we have, our values and our culture, our skills and our strength, the training that we've gotten. There's so many pieces of context that impact the way the care role impacts us. So if we are not sure, gosh, I'm having a really hard time with this and I don't understand why. Part of it is because it's not just caregiving on its own. It's because it happens in context of everything else in our lives. And I think something that's one way that we can help think about this is to think about the way the role or the change that we're experiencing impacts our roles, our relationships, our routines, and our assumptions. So I'm not going to go deeply into this. If you all are interested, this can be a topic for a different day where we deep dive into how to think about roles, relationships, routines, and assumptions. But caregiving impacts all of these things. An example, I think assumptions is hard to think about. So an example for me is that when I suddenly fell into a care role, the assumptions that I had about the way I could spend my time or the things that I was structuring my life around completely upended. And I had to make different assumptions about, ooh, can I have a meeting at work? I don't know. I can't make that assumption anymore. I have to build in more flexibility into my life. So here's another way to think about this. So I like to have these ways of thinking because for me, it helps structure my thoughts. So that's why I'm sharing this with you. And we're going to talk through it, not super in depth, but we're just going to plant the seed. And if you all are interested, we can come back to this in the future. So the first thing that impacts the way we're impacted by our care role is the situation itself. So what kind of role changes are we experiencing? Do we have control over it? How long is it going to last? Are there stressors that are impacting us? But what we bring to the table is also important. So there's aspects of ourself that influence the way that we're impacted. So some of that is life stage. I mentioned that already, but also what's our health? What values are we bringing to the table? What kind of resources do we have, whether that is financial resources or internal strengths that we can draw on in order to adapt and change and be resilient? There's the strategies that we use. This is coping skills and approaches. I often talk about this as the things that we do or have done in the past that have worked for us when we were facing a hard time. These are the things that we can rely on now. And there's stuff we do that works really well and we should definitely lean into. There's stuff we've done in the past that maybe worked in the moment, but wasn't super healthy long term. So if we think about this ahead of time, we can plan out, okay, I know what I'm going to do. I'm not going to do these things. I'm not going to shove my face full of cookies. I am going to do these other things. And then there's the role of social support as well. And so this is families, friends, but also similar others. So people who are in a similar role. It's great to have support from family and friends. And also sometimes it's really important to be around other people who we feel like get it, who we feel like have a similar lived experience. And when we talk about what we're experiencing, they totally understand it because they have been through something similar. So all of these things kind of make up that context. And we can think about all of these things and how we can leverage these things to improve the way that we're interacting with the caregiving situation, to improve the way that we're responding to it so that we can be set up for success. And in the context that different things work for different people. So what works for me isn't going to work for you. And there's a lot of offerings out there that help with these different things that work for different people, which is something we can navigate. It can be a lot to absorb, but once we figure out, oh, here's the thing that's going to work for me. I want to try this and see if it works. Then we can lean into some of those resources and support services. Okay, so we're wrapping up here. That's where I'm going to sort of leave you with the anticipation that I would love to do more of these in the future and bring people in to learn more about some of these different places. But I want to leave you with some examples of what we can do. So if we're not in a care role yet, one of the things that we can do is just reflect on those pieces that we just talked about: situation, self, support strategies. What's going to help us? What's going to make it harder? How can we prepare for that? We can build awareness and plan. That's kind of what we're doing right now, is building that awareness of that experience of caregiving and what those care tasks are. And then we can also lean into planning ahead for what we can do in order to set ourselves up for success, whether that is coming up with a plan with family, whether that's thinking about the different skills and resources that people have that can come together, or whether that is just sort of laying the groundwork now. And so laying the groundwork is also building skills and practices that we know can help us later. So I'll say that when I took on a care role, I finally started getting into mindfulness. People talk about mindfulness all the time. And I was always like, oh, yeah, mindfulness. It's great. We're supposed to do it. It's really helpful, whatever. I don't have time for that. I wish that I had built those skills before becoming a caregiver, because that is one of the core tools that I have used in order to be healthy and well while doing a care role and stay balanced and present. And so if I could go back in time, I would have built those skills ahead of time instead of trying to start it once I was in a sudden care role. If we're already in a care role, we can do all of those things. So all of those things that we do before care roles, we can do right now. And I know that when we're in a care role, we often have a lot on our plate. And it can be hard to think about learning new things or trying to figure something out. Like, sometimes we just feel really tired, and that's okay. But once we're in a care role, thinking about what our needs are can be really helpful, and sort of knowing, oh gosh, I know that I do have the time to vacuum, but man, it's just not a priority. Maybe I can have someone come in and help me vacuum and make sure that my house is clean, because otherwise it's just not going to get done. And that's also based on preferences, and those differ from person to person. We can reach out for support based on our personal needs and preferences. We can recognize that we're part of a nearly universal experience, and we can practice self-compassion, because whether we're having an easy time or a hard time, we can be compassionate with ourselves about that experience and about the fact that it's going to change from moment to moment. And that can, giving ourselves grace and kindness, I think, is one of the best things that we can do when we're facing a hard time, whether that's caregiving or something else. So I talked about skills and practices. I just want to give a couple examples of these, and this is just going to be real quick. So these are things that I know from research help caregivers. And this is stuff that I always hesitate to bring up, because, like, I don't need anyone to tell me that I should exercise. And I bet you don't either. You already know that. We all already know that. But the thing is, we know that when people are moving their body, it helps their brains and it helps their stress response. And so I'm pointing these things out in order to say that there's lots of different skills and practices that we could maybe think about cultivating, and stuff we could think about cultivating now before we really, really need it. And the thing that has to be internally driven. So we can't start a mindfulness practice, for example, because someone else says, hey, you should start a mindfulness practice. Maybe you would really enjoy it and it will work. And maybe you're like, no, I don't like this. Or no, I'm not going to do it because you told me to. And so there's a lot of different options of things that we can build. And some of that is just reflecting on, I know what's worked for me in the past. Maybe I can build those skills in and create a really strong practice around the things that I know help me, so that when I need it, it's there and I can fall back on it. This is just a couple examples of assessing needs. So again, this is in your slide handout. I don't love any of these in particular, because I don't think they do a job of capturing all of the needs that caregivers might have and then connecting them with information and resources to help them with that. But these are a few different options that you could maybe explore if you're in a care role to help you think about needs and resources. I'll mention the bottom one, the Caregiver Help Desk. That's a phone number. It's a website on here, but there's also a phone number that you can call and just talk to someone. And it's okay to say, I think I'm in a care role. I need something and I don't know what, because their job is to help you talk it through. The last piece that I will leave you with is a few things that you can think about if you're in a care role. Oh no, look at this slide. This did not work out right. A few things that you can work out. So the first one is, next week, Heather Quackenbass is going to be joining us to talk about self-compassion, because I think that, as I said earlier, giving ourselves grace is one of the best things that we can do when we're facing a hard time. And it's a skill that we can learn. So Heather's going to be here talking about self-compassion. So if you're interested in that, please join us next week. There's also an extension program called Planning Ahead. This is a program that helps people think about all of the planning that they need to do, thinking specifically about what do we need to know before the end of life, but stuff that's really important to do right now. So things that young families should do, things that aging families should do, things that everyone should do, things like estate planning, retirement planning, power of attorney, thinking about grief, thinking about loss, and how we can plan ahead for those things. So these are that program is available in person in a few different counties, and there's also a statewide program that's enrolling right now, that's on Zoom. So that is an option for people who are interested in that. And when I get done here, I'll put all those links in the chat so that you can see them. If you're interested in mindfulness, again, I'm mentioning this because it's been so powerful for me and my care roles. The Center for Investigating Healthy Minds at UW-Madison has a free app, and it's really beautiful and lovely. I love this app because it doesn't make you choose. You just do the next meditation, and it builds skills over time. And it has options for walking meditations. So you can say, oh, I'm going to do a seated meditation. So I'm just going to sit here and I'm going to close my eyes and I'm going to breathe. Or I'm going to walk the dog. I'm going to do the dishes. I'm going to knit. And you can do mindfulness in those spaces at the same time. And I love that because it's so much easier for me to do this practice if I'm walking my dog and can have that 20 minutes to do it. And it doesn't have to be 20 minutes. It can be 5 minutes. It can be 20. It can be 10. And then if you're in a care role or you know someone in a care role, the first place to go for information about support and services locally is your local aging and disability resource center. So these are located all across the state. You have one that is your local center, and they can help figure out, what do I need? What does my care recipient need? What's out there for me? So that's always a good first stop as you're starting to learn more about support services that are out there. So that's where I will pause. And I think we only have 1 minute left, so I'm ending right on time. But I'm open to any discussion that we want to have or comments that you want to put in. And in this last minute, we're going to put the link to the evaluation in the chat. So please, please, please do that evaluation, because that's going to help us know what you want to learn more about, if you want to be involved in these conversations more, and how this program worked for you. Because we're starting to think more about how to help people before they become caregivers. And so your contribution to that is really going to be valuable. I'll open it up for any discussion that we want to have. And
Well,
thank you all.
Thank you, Kristen. You get a lot of thank yous, and that this is an excellent program and quite helpful for everybody. So I want to thank you for coming and presenting. I want to thank everybody else for joining us, and Alicia for providing our tech support.